Watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the latest advancements in liposculpture techniques. My first guest is a cosmetic surgeon that specializes in this procedure. If you have certain fat areas on your body that are not responding to diet and exercise, you have to hear what my first guest has to say. My advice, stick around for the latest edition of the Wellness Hour.
You've seen it on TV. You're probably watching it right now. The Wellness Hour, the leader in medical news and information, has been on your television over the last 5 years, is now on the web. Log on to wellnesshour.com, where you'll see some of the most intriguing interviews of today's top physicians. Wellnesshour.com provides links to all your favorite doctors seen on the show, links to email host Randy Alvarez, and more. Don't wait another minute. Log on to wellnesshour.com and start feeling better today. Wellnesshour.com. Log on now.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the latest advancements in liposculpture techniques. My first guest is Jeffrey B. Schafer, MD. Dr. Schafer is the medical director of New Image Cosmetic Surgery. He's one of the busiest surgeons in the world when it comes to liposuction. Dr. Schafer, welcome to the program.
Welcome. Thank you for inviting me.
Now, we've invited you on the show. You do a lot, according to my notes, of these procedures.
Yes, we do approximately 80% of our volume of patients is liposculpture, and it's about 700 cases per year, about 3,000 areas per year.
Now, you trained with the pioneers of liposuction, the first guys that did this. Is that right?
That's true. I really wanted to learn the technique from the masters. I wanted to spend time in the operating room with them. I wanted to know the techniques, the newest techniques and the basic techniques, and learn from the people that originated it.
Is there really technique to this? It's not just going in and sucking fat. There's a lot of technique. It's technique driven.
A lot of the technique is based upon skill and exercising judgment and experience and obtaining an excellent result.
And why do you like to do liposuction?
Well, it's sort of a frustrated artistic ability that I found that I had sculpting along with photography, and this enables me to get my artistic side out, and I enjoy giving people their bodies back. I enjoy giving people a waist they've never had. I enjoy giving a body back to a woman who's had a child, or a man who's always been overweight, or we've done people that are Marines, we've done Navy SEALs, we've done professional basketball players. All these diet and exercise resistant areas don't seem to respond, and this is our chance to give them, in some cases, a jump start, so that they can actually go back to the gym and start rebuilding their lives and rebuilding their shape. Some people are embarrassed to go to the gym, they're so large.
Do you recommend people lose as much weight as they can before they get liposuction?
Randy, I think that's an old-fashioned myth. I think that people, if they could lose weight that easily, if they could take off 50 pounds, they wouldn't need me. So they're coming to me because they are having trouble losing the pounds.
Okay.
So we know that we can take off in each session 6 liters or 12 pounds per session, and that is gone permanently. And this allows the patient to not have to diet, but if they want to, they can use this as a jump start, and they can start going to the gym and exercising and eating a little better and show an improvement after they've gotten rid of the troubled areas that were not removed with diet and exercise.
Is it fair to say that you're aggressive, more aggressive than most when it comes to liposuction?
No, there are guidelines put out by the state of California. I stay within those guidelines, between 5 and 6 liters of fat, or approximately 12 pounds. If I have to do more than that, I do that in 2 sessions.
So you do it in 2 sessions.
Right.
So that's a step further.
The safety is extremely important in our office. I've been doing office surgery for 25 years. We have an impeccable safety record. We've never had any problems in our office. We don't use general anesthesia. Everything is done under local IV sedation. And we're very proud of our office, our staff, and our safety record.
Let's go there for a moment before we get into today's topic, the specifics of the procedure. Tell me about your practice.
Well, my practice is predominantly liposculpture. We actually call our technique Microlipo because we use small cannulas. We do usually 3 cases a day, 5 days a week. We do some other procedures, but the majority is liposculpture.
This is all you do. This is your specialty.
This is it. We either do our own patients originally, or we get a lot of patients that have been unhappy with their results, that we do corrective surgery and revisions.
Now, according to my notes, people are traveling all over the world just to get liposuction from you.
Well, I think
is that right? Is that fair to say?
I think it's due to the internet, really, and also we get a lot of patient referrals. But people find out that we do the type of work, and that there are very few people that do, and they seem to feel comfortable with our office. And we also get a lot of patient referrals. People that were unhappy and have spoken to someone who came to our office and realized that we can fix their problems.
So you mentioned sculpting early. Is there art to this?
Randy, there's definitely an art. It takes experience. It takes a good eye. I personally think that from our advertisements to the way our office is decorated to the way that our business is handled, everything is done from our website. Everything is done from an artistic standpoint, including the surgery. And somebody has to have a good eye to coordinate the areas. For instance, if you were having your car repainted, if they repainted the door the wrong color, it would not blend.
Right.
So the area being worked upon has to blend with the surrounding tissue. Some people call this feathering. It has to have a natural appearance. Women have curves, for instance, and you want to give them the curves in the right area. You cannot just start and stop.
Are you implying that it's not always done this way?
I think a lot of people don't enjoy liposculpture. I think a lot of people are more...
Why is that, by the way? Because I told you, the doctors I talked to, it's rare that they like doing lipo. Why don't they like it?
It's tedious. It's time-consuming. It's messy. It requires a different type of surgical experience. It's a little bit more physical than doing a facelift or eyelid surgery. And it's not everyone's enjoyment. And for me, it's sculpting, and I love seeing the results. I love seeing the finished product. I love looking at that patient saying, I think I've done the best job for her I can. I think she's got a waist now. Her stomach is gone. I think she'll be happy with that result.
Are the patients getting younger and younger, older and older?
We see people of all ages. We've done people in their 80s and people
80s getting liposuction.
That's true, and people in their teenage years.
Okay, what's the downtime, by the way, to liposuction?
We take approximately 3 days of recovery time. People having extremely large procedures may take a little longer, but it's very typical for people to say, I had my surgery on Friday, I went back to work on Monday, and our saying is, give us a weekend and we'll give you a new image.
You call it microlipo. Why is that?
Well, we want to get the ultimate result. We use very small cannulas. We want to sculpt